Most people over 60 are doing everything they have been told. The medications, the checkups, the evening walk, all of it. And yet, every single morning, without realizing it, without anyone ever warning them, they are doing one thing that quietly puts their heart at risk. Not at the gym, not at the dinner table, not during any moment they have ever been told to worry about. In the first 90 seconds after they wake up. I have spent over 20 years as a cardiologist watching hearts fail. I have sat with families in waiting rooms. I have reviewed the files of patients who did everything right, the right medications, the right diet, the right checkups, and still ended up in front of me. And in more of those cases than I can count, the answer was hiding not in their blood work, not in their medications, not in anything a standard examination would catch. It was hiding in a habit so automatic, so unremarkable, that not one of them had ever thought to mention it, and not one of their doctors had ever thought to ask. My name is Dr. Helen Sanders. What I am going to show you today is something almost no one in medicine discusses with their patients, and after 20 years, I am still not sure why. A free 3-step protocol that takes less than 90 seconds each morning, and the precise biology that explains why it works. I'm also going to tell you about a patient named Douglas, a man who did everything right, who had a clean cardiogram, who was, by every measure, managing his health well, and who one Tuesday morning took 3 steps toward his bathroom and didn't make it. Stay with me, because what I'm about to share may be the most important cardiovascular information you have never been given, and the most actionable thing you will do today costs nothing and takes less than 2 minutes. Let's start with what actually happens to your heart while you sleep. Your cardiovascular system runs in low power mode overnight. Heart rate slows, blood pressure drops, your nervous system settles into its quietest state. It is the only genuine rest your heart gets in a full 24 hours, the one window where the engine is not being asked to perform. But here's what most people don't know. The moment your brain begins waking up, before your eyes open, before the alarm sounds, sometimes a full 60 minutes before you are fully conscious, your body begins flooding your bloodstream with 2 stress hormones, cortisol, adrenaline. Not gradually, purposefully. Your body is preparing for the demands of being upright and alive. By the time your hand reaches to silence that alarm, those hormones are already surging, and in seconds, they do 3 things to your cardiovascular system simultaneously. Heart rate climbs, blood pressure rises, blood vessels constrict, narrowing the very channels your blood depends on to move freely. At 35, your cardiovascular system absorbed that surge without difficulty. Elastic walls, fast reflexes, the system adapted and moved on without incident. After 60, the picture changes fundamentally. The arteries are stiffer, the walls are slower to respond, and in many people who feel perfectly healthy, who are taking their medications, who had a clean scan recently, who are doing everything right, there is plaque silently built up inside those vessel walls. Plaque they have no idea is there. When that hormonal wave strikes a vessel wall carrying vulnerable plaque, the force can fracture it. That fracture triggers the body's clotting cascade. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. This is not a worst-case scenario. It is the mechanism. Research published in the American Heart Journal has found that cardiac events are significantly more likely between 6 and 10 in the morning than at any other time of day, with some studies placing that elevated risk as high as 40% in adults over 60. Not random, not bad luck. Biology. Entirely predictable if you know where to look. If that is the first time you have heard that, you are not alone. Most people never do. And if this kind of research-backed, practical cardiovascular information is something you want to keep receiving, I publish it every week on this channel. Subscribing takes 5 seconds, and it means you will not miss what I'm about to show you. Because what comes next? The second mechanism is the one I have seen go unrecognized in patient histories more times than I can count. The cortisol surge is only the first reason the morning is dangerous. What happens the moment you stand up is a completely separate threat, and it operates every single morning whether you feel it or not. When you are lying flat, blood is distributed relatively evenly throughout your body. The moment you stand, gravity pulls a significant volume downward, away from your brain, away from your heart, toward your legs and abdomen. Your cardiovascular system must respond instantly, constrict the vessels, adjust the rate, restore adequate pressure to the brain. All of it in seconds. In a younger person, that reflex fires quickly and cleanly. In adults over 60, the reflex slows. Blood pressure can drop 15, 20, sometimes 30 points within moments of standing before the system corrects. You're running on low pressure to the brain, to the heart, to all of it. You may know this feeling without knowing what it is. That gray, slightly washed out moment when you first stand. A second of holding the edge of the nightstand waiting for the room to settle back into focus. A beat where the world goes slightly dim before it returns. If you have felt that, and a meaningful number of people over 60 have, you've probably told yourself it is just getting older, part of the deal. It is not. It is a warning, and it is happening at the worst moment possible. When blood pressure drops after standing, the heart doesn't wait. It compensates aggressively, spiking its output to force pressure back up. In a heart already working against stiff vessels while cortisol is surging, that compensatory spike can trigger an arrhythmia. It can fracture a vulnerable plaque. Standing up quickly is not merely uncomfortable for some people over 60. It is a genuine cardiovascular hazard, one that almost no one has ever been told about. And there's still a third factor. This one operates invisibly inside your bloodstream every morning before you have moved a single muscle. You have been asleep for 7 or 8 hours without water. Every breath you took through the night carried moisture out of your body. By the time your alarm sounds, your blood is thicker and more viscous than it was when you fell asleep. Think of your heart as a pump and your blood vessels as the pipes it moves fluid through. When the fluid is thin and free-flowing, the pump works efficiently. When the fluid is thick, every single beat costs more effort, and thicker blood clots more easily. Research consistently shows that clotting factors reach peak activity in the early morning hours. This is one of the primary reasons strokes and cardiac events cluster so heavily in that morning window. It is not coincidence, and it is not random. It is precise, predictable biology. So now we have 3 threats converging on the same system at the same moment, every single morning. The hormonal surge driving pressure into vessel walls that are stiffer than they once were. The act of standing producing a blood pressure drop that the aging cardiovascular system is slow to correct. And blood running thicker and more clot-prone than at any other point in the day. 3 separate mechanisms, 3 separate risks, all arriving together in the same 90-second window. And one morning habit, so automatic, so unremarkable, so completely unquestioned, sharpens all 3 of those threats into a single dangerous point. Before I tell you exactly what that habit is, I need to tell you about Douglas. Douglas was 68, retired school principal, a careful, methodical man who took his health seriously. He took his blood pressure medication every morning without fail. He walked 30 minutes 5 days a week. He never missed an annual checkup. His last cardiogram was clean. His cardiologist had told him in those exact words that he was in good shape for his age. By every clinical measure available to his doctors, Douglas was managing his cardiovascular health well, better than most men his age, better than average. One Tuesday morning, Douglas woke up and did what he had done every single morning for 15 years. He silenced his alarm, sat up, swung his legs to the floor, stood. He took 3 steps toward the bathroom. That was as far as he got. His wife heard the sound from the other room. She found him on the floor. When I reviewed Douglas's file afterward, nothing should have predicted it. His medications were appropriate. His fitness was above average for his age. His blood work was unremarkable. His cardiogram had been clean. By every standard measure we use to assess cardiovascular risk, this should not have happened to Douglas. But in 15 years of morning routines, 15 years of standing up fast every single day, nobody had ever asked him about those 25 seconds. Not his GP, not his cardiologist, not the specialist who reviewed that clean cardiogram. Not a single physician in 15 years had ever asked Douglas how he got out of bed in the morning. And Douglas had never once thought to mention it, because why would he? It was just how you got up. It was just what you did. I am going to come back to Douglas, because what happened in the 6 months after he walked out of my ward, one single change that shifted his morning blood pressure readings in ways that 3 years of careful medication adjustment had not managed to achieve, is the reason I made this video, and it is simpler than you are expecting. Here is the habit. Alarm goes off, vertical in under 3 seconds, every morning, without thinking. That is it. That is the habit. The one I see in the histories of more early morning cardiac events than any other single factor I have encountered in 20 years of practice. It feels like nothing. It has never once crossed your mind as something worth questioning. It is just how mornings begin. And for a cardiovascular system already navigating 3 converging threats, the hormonal surge, the orthostatic blood pressure drop, the thickened blood, all 3 threats, one action, one window. This is the highest risk cardiovascular period of the entire day for adults over 60. It has been extensively studied, it is well understood, and it is almost never discussed.
Now, here is what I want you to hear clearly, because this is the part that matters most. The fix is not a prescription. It is not a procedure. It is not one more thing to manage, monitor, or pay for. It does not require a doctor's visit or a device or a supplement. It is free. It takes 90 seconds, and starting tomorrow morning, it is yours. I call it the 90-second heart protocol. 3 steps, no equipment, nothing to buy. Step 1, 3 breaths before you move. The moment your alarm goes off, stay exactly where you are. Do not reach for it yet. Take 3 slow, deliberate breaths. In through the nose, fully and completely. Out through the mouth, slow and controlled. Not shallow, not hurried. I want to be specific about why this works, because this is not a relaxation technique. This is a direct cardiovascular intervention with measurable effects. Slow, controlled breathing activates the parasympathetic nervous system, the calming branch, and begins to counteract the cortisol and adrenaline surge before it has reached its peak. Research on deliberate breathing immediately upon waking shows measurable reductions in the morning blood pressure spike in older adults. You are not reacting to the surge after it has already built. You are meeting it at the door, before it peaks, and blunting the force it would otherwise deliver to those muscle walls. 3 breaths, 15 seconds, then silence the alarm. Step 2. Water before your feet touch the floor. Tonight, before you go to sleep, put a full glass of water on your nightstand, at least 8 ounces, room temperature. Tomorrow morning, before your feet touch the floor, drink it. That glass of water immediately begins reducing blood viscosity. It lowers the clotting activity that has built through the night. It gives your heart better, thinner fluid to work with before the demands of standing and moving begin. A study tracking older adults over an extended follow-up period, published in the Journal of the American Medical Association, found that this single habit, water taken lying down or seated before standing, was associated with a meaningful reduction in early morning cardiac events in adults over 60. 1 glass of water before you stand. That is all. And if there is ever a morning, travel, disruption, illness, whatever the reason, when you can only complete one step from this entire protocol, let it be this one. This is the single highest return 90 seconds in your morning. Step 3. Sit before you stand. Do not move from lying flat to vertical. Roll to your side. Push yourself up slowly. Bring your legs over the edge of the bed. Sit for 30 full seconds, not rushing, not glancing at the time. While you sit, rotate your ankles slowly, 5 circles in each direction. This activates the calf muscle pump, pushing blood that has pooled in your lower legs back up toward the heart. It helps your cardiovascular system restore adequate pressure gradually before the demand of standing arrives. After 30 seconds, rise slowly. Stand, then pause for 10 seconds before your first step. You have just given your cardiovascular system the transition it was never getting in the automatic 3-second stand you were doing every morning before today. You have addressed the hormonal surge. You have addressed the blood viscosity. You have addressed the orthostatic drop. 3 breaths, 1 glass of water, 30 seconds at the edge of the bed. 90 seconds. Your heart has worked for you every minute of every day without ever asking for anything in return. This is 90 seconds back. It is not a burden. It is the least expensive cardiovascular investment you will ever make. One more thing, and this is specifically for anyone currently taking a diuretic for blood pressure. Diuretics work by flushing excess fluid through the kidneys. They are effective, widely prescribed, and appropriate for millions of people. But when the kidneys flush fluid, they also flush magnesium. And magnesium regulates the electrical signals that control your heartbeat. When magnesium levels fall, and research suggests this happens quietly in a meaningful number of people on long-term diuretics, the heart's electrical regulation can become less stable. You may notice it as palpitations, a flutter in the chest, a rhythm that occasionally seems to skip or hesitate, particularly in the morning when the heart is already under its greatest daily stress. If any of that sounds familiar, raise it with your doctor at your next appointment. Ask for a magnesium level check. It is a standard blood test. If levels are low, your physician can advise on dietary approaches or supplementation appropriate to your specific situation. This is not cause for alarm, it is simply a conversation worth having, one that for some people turns out to be exactly the right one at exactly the right time. 6 months after his discharge, Douglas came in for his follow-up appointment. His wife had been tracking his blood pressure every morning at home, writing the numbers in a small notebook she kept on the nightstand. For the first time in years, the readings were stable. The gray, unsteady feeling he had experienced every single morning for a decade, quietly written off as just getting older, just the way mornings felt now, was gone completely. His cardiologist reviewed the numbers and asked what had changed. New medication, different dosage, some adjustment to his routine. Douglas said, "I stopped standing up fast." His cardiologist, who had been reviewing Douglas's treatment plan, adjusting his medications, and monitoring his cardiovascular markers for 3 years, had never once in 3 years discussed the morning transition with him. In the corridor on the way out, Douglas stopped and looked at me. He said, "Why didn't anyone tell me this sooner?" I did not have a satisfying answer. I still don't. What I told him then is what I am telling you now. The research exists. The mechanism is understood. The biology is not complicated. The habit is free to change and takes 90 seconds. It simply needs to reach the right people before the morning it matters most. You are that person, and now you have it. Here is what you know now that most people never learn. 3 biological threats converge in the same window every single morning. The cortisol surge, pressing force against vessels that are no longer young, blood thickened overnight and primed for clotting, and the act of standing, automatic, unquestioned, completely fixable, that drops pressure and forces an aggressive cardiovascular correction at the exact moment the other 2 threats are already at their peak. The 90-second heart protocol addresses them directly. 3 breaths before you move to meet the cortisol surge before it peaks. Water before your feet touch the floor to reduce blood viscosity before the day begins. 30 seconds sitting at the edge of the bed to give your cardiovascular system the transition it needs to carry everything that follows. Tonight, one thing. Put a glass of water on your nightstand. That is where it starts. That one action, tonight, is the beginning. If someone in your life wakes up like Douglas did, moving fast, feeling fine, never having been told any of this, share this with them. You may not know in this moment how much it matters, but one morning you will. This video contains general health information based on published research and clinical experience. It is not a substitute for personal medical care. If you are managing a cardiovascular condition or taking cardiac medications, please speak with your own physician before making changes to your routine. That is exactly where good medicine begins.